effective. Also very effective for prostate problems, hemorrhoids, rectal tumors that are down below. So
You talk about the clay. What is the clay?
the clay is a natural volcanic area clay that comes from the earth, from the soil, and it has most of the minerals that the human body needs. But it has another property. It not only, if it is applied or taken by mouth or intrarectally, it gives the organism what it needs. It gives a lot of energy if you need minerals. But it also takes out poison from the body. It can take, if it's used as a compost, it can pull out things that are not meant to be there. And that is a property that clay has also. It's given as a supplement in many conditions such as candida. It can take care of toenail fungus. It can take care of any problems in the intestine. Also, it can take care of skin cancer and many other conditions, acne, cuts, bruises. It's better than any other antibiotic gel that is used for infections, cuts, or scrapes. So there are many uses that I'm finding out daily as I go along and try this with the patients, because the human body will heal if we give it what it needs. It's as simple as that. But we need to make this available to the body by different ways and routes, which is what I have just explained.
How was that Miguel Cisneros and Dr. Victor Marcial-Vega got together for these wonderful things that you're doing?
We met 2 years ago when the first shows were being made here.
Mm-hmm.
And that's how we started. And I thought that what Miguel was doing was fascinating.
It is.
And since then, I have been implementing this into my practice more and more every day.
One of the main things that aromatherapy benefits those who are going through illness, and even those who just get in the car and go through traffic, is the way that it reduces stress. Since essential smell goes directly to the brain and to the nervous system, there are some essential oils that you're able to smell, and you actually feel the effect of reducing the stress. So therefore, traffic doesn't seem to be so hectic on an everyday basis, which any time that you're stressful, you pretty much are creating chemicals that have been known to harm us. So if we're able to diffuse stress, we're able to then get involved with our healing.
Yeah, because I heard that certain airlines are using also essential oils.
Certain airlines should use some essential oils and diffuse in the air, because we already have established the quality of air that certain airline has. And you're talking about putting numbers of people there on an everyday basis, and the air recirculates. So therefore, the ASHU, airborne bacteria, which could be from tuberculosis of different species to anything that's airborne, it will be there from the first flight to the second flight, unless they're able to diffuse certain aromas that in historical times, when we were faced with the plagues, we diffused against the tuberculosis, against the Black Death plague, and so forth. So certain airlines, yes, should.
Especially for, I believe it's very good for very long trips. It relaxes the passenger.
Besides that, some essential oils, once again, because the olfactory system is connected to the brain and to the nervous system, has worked excellent for jet lag. But the main protection is from airborne bacteria that one faces in any transportation system that groups of people uses.
Victor, how do you know that your patient is doing well with your treatment? How do you realize that?
I monitor them in 2 ways. One, by following the physical examination. For instance, if there's a cancer and it's superficial and I can feel it, I can follow how it's doing. If the cancer is deep inside, I can do CAT scans, which are x-rays that will tell me how the internal organs are doing. But one of the most important things I use is the monitoring of symptoms. How the pain is, their appetite, how they're sleeping, their well-being, they're feeling fatigued or energetic, whether they're having diarrhea like they were before, whether they're not, any aches or pains, any feeling whatsoever will tell me how the treatment is doing. Because no one gets better and the symptoms get worse. One gets better together with the other, and he may even be getting better before we can see a change in the CAT scan or the physical exam. The way that the patient feels may be a predictor of what we're going to see in the future. So it's very important to follow the symptoms, and that change can be seen within a few days. So it'll give a patient reinforcement. In addition, my partner, Dr. Skupin, has a live blood cell analysis where he takes a drop of blood and we look at it before the treatment. Then we look at it during the treatment, and the blood starts getting better by several factors and indicators we have. So it's a great positive reinforcement to the patient. Listen, this is working. So it's not only the way you feel, we're looking at it and seeing it in the blood. And then we see it in the CAT scan or whatever.
Yes.
There's one thing I must add. There's something that Dr. Marcial-Vega does within his practice that is very unique to a medical practice. And in feedback from his patients, I have heard that how this actually has added to the recovery. He spends about 45 to 50 minutes per patient and their family, which I think is beneficial to the whole in the explanation and getting to know the person's background, their life, before he even begins to get involved in a treatment. So that in itself, in getting involved with a person's life, once again, with the feedback that I've been getting from the patients and what I've been seeing, that's a very unique approach to that. And
that is great.
I just want to ask, which I never did ask, but I just wanted to ask him, what made you go into, because normally it's like 10 minutes, 15 minutes medical appointments. What made you get involved with
you have to
with a full 45 minutes?
Because we are almost running out of time.
It has to be done that way in the beginning because I need to listen to what everyone is saying.
Yeah.
First of all, the family affects the health of that patient. Then I have to listen to what the patient is saying, body language, eyes, the body, the physical exam, the color of the skin, many things. So I need to see all those things. Eventually, as I get to know them better, it takes less time to do it. But it's essential so I can see how they are today in order for me to compare and see how they are tomorrow or the day after or the week after. So it's essential for follow-up for me to listen and then assist them to learn how to listen to themselves, which is the second part of the equation to complete the circle. So it takes time to do that, but I don't see it as unique. I see it as a crucial part of the health process.
Thank you very much. Miguel, I have to invite you for the next program because we had a lot to talk about aromatherapy. So
I would love to come back.
You're going to be back. Dr. Victor, also, you are going to be back in future programs. Thank you very much.
Thank you.
And thank you to all of you. Until next time.